Sweden has taken a very different approach to dealing with COVID-19. It relies on the population becoming infected over time in order to build up a form of herd immunity. But is it the right one? Does the risk justify the outcome? How many people are likely to lose their life to this virus in the months ahead? This video mathematically models the spread of this virus based on published data that is freely available in the public domain. It compares the number of deaths in Sweden with those of Australia and the UK. And the data can be found at this website here. And this website collects data published by governments around the world, and so it's a very reliable source. All right, this picture here of a restaurant in Sweden, I think in Stockholm, shows something that is not and has not been happening in Australia now for a while. It's banned in Australia. Restaurant, pubs, clubs and so on in Australia have been banned as part of social distancing measures. However, the Swedish approach is different, and that is the subject of this video. Now, Sweden has chosen to allow its population to become gradually infected with COVID-19 in the hope that a form of herd immunity can be obtained in the longer run. Such a policy was abandoned by the UK after modelling revealed the consequences of allowing the virus to infect the population, and that involved deaths in the range of 250,000 to 500,000, and the NHS being overwhelmed. Now, Dr. William Hanniger, a professor of evolution and epidemiology of infectious disease at Harvard, wrote in The Guardian, such a policy would result in large numbers of people dying and the NHS being overwhelmed. He reflected the general bafflement among many experts because herd immunity is typically achieved via widespread vaccination against a disease. There is no vaccine for COVID-19, and herd immunity without a vaccine assumes that the vast majority of people who recover from the coronavirus will then be immune, which has not yet been conclusively established. So the idea of herd immunity through allowing people to become infected is a misunderstanding of the concept itself. Herd immunity only occurs after a population has received a vaccine. All right, so Sweden's strategy is based entirely on the idea of the population being exposed to this virus and then becoming immune to it. So where is the scientific evidence to support the idea that people become immune to COVID-19 after being infected and then recovering? Well, not enough is known about this virus for anyone to just jump in and expose themselves to it in the hope that all will be well, as appears to be the case with Sweden. For instance, are any of us immune to the common cold virus? That virus circulates every year, there is no vaccine, and we definitely have no immunity to it, which is why we continually are reinfected each year. How about the AIDS virus? No one's developed an immunity to that. That still remains a dangerous virus, again, for which there's no vaccine. But anyway, what do the experts say on this? I'm not a biologist, I'm not an epidemiologist. I can only look on Google and look what the experts themselves are saying. So let's see what they say. All right, let's start with something from The Guardian here. For some illnesses, including other circulating coronaviruses, the immune system wages its battle and then a few months later forgets it ever happened. Others, like chickenpox or mumps, trigger lifelong immunity. The truth is, we're not yet sure where on this spectrum COVID-19 lies. Reasonable guesses are that there might be partial protection for close to a year, according to Marcus Lipsitch. Now that's reasonable guesses, because nobody knows. A professor of epidemiology at Harvard, whose team recently predicted that in the absence of a vaccine, social distancing may need to continue until 2022. What he then goes on to say is, on the long end, it might be several years of good protection. It's really speculative at this point. There are other risks with being infected by the virus that are not yet understood. And so how a government could commit its people to being infected by a virus with so little understanding of how the virus works doesn't make sense. And that's the point of this video. Again, let's listen to what the experts have to say. So here's an article from the Washington Post, quoting reputable people in that field. So based on early reports, COVID-19 appeared to be a standard variety respiratory virus, albeit a contagious and lethal one with no vaccine and no treatment. They've since seen how COVID-19 attacks not only the lungs, but also the kidneys, heart, intestines, liver and brain. Lewis Kaplan, a University of Pennsylvania physician and head of the Society of Critical Care Medicine, said every year doctors treat people with clotting complications, from those with cancer to victims of severe trauma, and they don't clot like this. The problem we are having is that while we understand that there is a clot, we don't yet understand why there is a clot, Kaplan said. We don't know, and therefore we are scared. There seems to be a problem with this virus causing clotting in the body, and we'll look a little bit further with that. Here's another study, another quote from some scientists in the New York magazine. In a study posted this week, scientists in China examined the blood test results of 34 COVID-19 patients over the course of their hospitalization. In those who survived mild and severe disease alike, the researchers found that many of the biological measures had failed to return to normal. Chief among the worrisome test results were readings that suggested these apparently recovered patients continued to have impaired liver function. That was the case even after 2 tests for the live virus had come back negative and the patients were cleared to be discharged. At the same time as cardiologists are contending with the immediate effects of COVID-19 on the heart, they're asking how much of the damage could be long-lasting. In an early study of COVID-19 patients in China, heart failure was seen in nearly 12% of those who survived, including in some who had shown no signs of respiratory distress. So couple this with blood clots. Our knowledge at the moment of this virus is very, very limited. Another study from researchers at Fudan University in Shanghai and the New York Blood Center provides more harrowing evidence for the long-term consequences of contracting the virus. According to the findings published in the journal Cellular and Molecular Immunology, when the researchers initiate contact between COVID-19 and lab-grown T lymphocytes, better known as T cells, the virus disabled the cells, which help identify and eliminate pathogens in the body. So this virus is disabling the critically important T cells, which protect us from disease. The researchers also found that SARS, a related coronavirus, which you remember a few years ago was quite a deadly one that circulated in Asia, could not infect T cells, whereas COVID-19 can. The study found that COVID-19's damage to the T lymphocytes resembled that caused by HIV. Quite a stunning thought. Another one. Clinicians around the world have found evidence that the coronavirus may be causing heart inflammation, acute kidney disease, neurological malfunction, blood clots, intestinal damage, and liver problems. Yale nephrologist Alan Klieger has found that close to half of those hospitalized due to the coronavirus have blood or protein in their urine, which are indicators of early kidney damage. Klieger also noted that 14 to 30% of intensive care patients in New York and Wuhan lost some level of kidney function. In a study published in the medical journal Kidney International, researchers in Wuhan found that 9 of 26 autopsied coronavirus patients had acute kidney injuries, and 7 had coronavirus particles in the organs. All right, here's a park in Sweden. Now in Australia, the beaches and the parks and so on have been closed and have been closed for some time due to social distancing. Again, the image is a very clear pointer to the approach being taken by Sweden, which thinks it can have its population infected with this virus and build up some form of immunity. All right, the cumulative number of deaths as recorded each day in Sweden. Let's start with the 31st of January, the first recorded case. There were 0 deaths for quite some time. The first death then appears on the 11th of March. The next death then is the 14th of March, and so on it grows. Up until this video has data up to and including the 24th of April, in which there were 2,152 deaths. All right, graphically, that looks like this. So starting back in the 31st of January, right up here to the 24th of April, this last point here. This is the published data as recorded at this website here, which collects data from published by governments. Okay, we can fit a mathematical model to this, a curve of best fit to the data, and this is the case. This last data point here represents the 24th of April, and the first data point here is the 31st of January. A model that describes this, the equation that fits this, is given here. T is the number of days since the 31st of January, and P is the number of deaths in Sweden. This is only concerned with the number of deaths. You can see how the curve fits the data quite well. How does this work? Well, here's the model here. This is the key number here we want to have a look at. So on the 21st of April, there were officially 1,765 deaths. This model predicts this amount here, and on the 22nd of April, the official number of deaths was 1,937, and this model is predicting this value here, quite close to it. Now, I've left the decimals on here just for the sake of completeness, for the sake of the public being able to take out their calculator, stop the video, take out the calculator and perform all the calculations I'm showing here, which I've shown you in a previous video on this subject, just to check. So I've left the decimal points in there so that members of the public can check for themselves and see that these numbers tally. But basically, if you take the value for the 21st of April and you multiply it by this base number here, you'll get the next day's predicted value, which is this value here. And that means that is this value here for the 22nd of April, the predicted value is 9.047% larger than the value for the day before, or 9.047% of this number here is that times that is that. And what I've done here is you'll find that that value here, this decimal here, multiplied by that value, gives you this. So deaths have grown 162 deaths from the 21st to the 22nd. You've increased the number of deaths by 162 in the space of 24 hours. If you add that then to the value for the 21st of April, you then get the value for the 22nd of April. All right. Now, the decimals again are included so that you can check the calculations, but of course you can't have 0.1392 of a case, or just as you can't have 0.13902 of a person. Okay, but again, the decimals are included for the sake of completeness, and so the public can check these numbers. So all of the above means that the daily rate of growth in the number of deaths in Sweden due to this virus is, as of the 24th of April, 9.047% per day for this model. All right, so how many deaths does this model predict in the days ahead? All right, well, here's the 25th, 2,538, the 26th, 2,768, the 27th of April, 3,018. If you keep coming down, 11th of May, you cross the 10,000 mark. 20th of May, you cross the 22,000 mark. Keep going down. 31st of May, you're up over 57,000. And by the 15th of June, you've crossed the 210,000 mark. These are just deaths. If the pattern continues, as shown on the previous page with the model, if that pattern continues, then this model is predicting deaths in the vicinity of 210,000 by the 15th of June. All right, just compare that. Here are the deaths up to the 24th of June, modeled in the same way with a mathematical model here. But you can see how the British curve here, the red numbers, the red dots represent the actual published actual values, and the blue curve represents the predicted values. You can see that the British deaths does not quite fit the exponential curve as well as the Swedish ones do, and we'll compare that in a minute. But you can see that there's quite a significant difference between the blue line, which is the model, which is the mathematical model and what it predicts. There's quite a significant difference here. The British death curve is not quite exponential. It's not as well fit by an exponential. Let's compare the two. Well, here's the British curve again, and here's the Swedish curve. See how the Swedish curve most closely, the actual values themselves most closely approximate an exponential curve. more so than the British figures. Remember, the red dots are the actual published numbers by governments. They're the actual deaths recorded. And you can see the British curve, the British data doesn't quite fit the exponential curve as well as the Swedish one does. The actual exponential curve showing that the rate of death in Sweden is exponential, is growing in an exponential way. You can see that the Swedish data more closely fits an exponential curve than does the British data. Daily rate of growth for the British is 24, as of the 24th of April, is 8.329% a day. As of the 24th of April, the Swedish rate as of the 24th of April is 9.047%. Okay, but you can see the Swedish deaths are more closely follow an exponential curve than does the British. All right, so how does Sweden compare with Australia? Early on in the pandemic, Australia appeared to adopt the idea of achieving herd immunity, following as the British were doing, in some sort of controlled way, albeit in a slow way. Fortunately, gave up that idea around the same time the British did, if not before, and then proceeded to lock down the community very quickly after that. The lockdown included closing all schools of all ages, restaurants, pubs, and all sporting clubs and events. Universities were closed as well. It included a ban on all gatherings involving more than 2 people. So people were not allowed to go visiting friends. Restaurants, cafes, all the rest closed down. Sweden. Now let's compare the two countries. Population as of this year, 10,000, just over 10 million, approaching almost heading towards 11 million. Number of confirmed cases as of the 24th of April, 17,567. Deaths, and this is as of the 24th of April, is 2,152. Australia has a population 2.5 times that of, more than 2.5 times that of Sweden, at 25.5 million. The number of confirmed cases as of the 24th of April is 6,675. Big difference. Total deaths in Sweden as of the 24th, 2,152, whereas in Australia it is 79. So huge difference between the two countries. And reflecting the difference in approach, Australia locked down its population quite firmly, unlike Sweden. The evidence is right here. The evidence for the consequences of locking down the population can clearly be seen in the different outcomes in the numbers of deaths between the two countries. All right. In all of this, the choice lies between the economy or saving lives. And all of us somewhere on that spectrum of saving the economy or saving lives will lie somewhere on that spectrum. Some people are all for saving the economy and forget about human life. Others are at the other end of the spectrum. You can tell by this video that I'm more towards the saving lives end of the spectrum by far. But I just note this quote from the Finance Minister of Sweden. Says, although the longer-term impact is obviously unknown, Sweden's strategy is not expected to preserve the country's economy this year any more than those of countries imposing stricter lockdowns. So Magdalena Andersson, the finance minister, said on Wednesday, GDP could shrink by 10% this year and unemployment rise to 13.5%. So if there's no benefit to having your population infected, no difference in economic outcomes between you and the rest of the world, then why do it? So little is known about this virus. Why just jump in and let your population become infected when you don't even know if any long-term immunity will result from this, from being infected in the first place? And just today, the World Health Organization has announced that there is no evidence that you cannot get it a second time. So they're saying that you cannot say that you won't get it a second time just because you've been infected the first time. Now, the implications of that are stunning. That potentially could mean someone becomes infected a second time after being infected a first time and recovering from it, becomes infected a second time and then dies as a result of that. That looks like the World Health Organization is saying that there's no natural immunity to being infected. That tends to suggest the ultimate answer is a vaccine. And until we get a vaccine, we need to protect our populations, not just let this virus run through. So finally, in closing, I would say stay home and save lives. Look at the case in Australia, New Zealand, other places. They locked down their economies. They've saved a lot of lives.